So we get a lot of questions about the psoas, and in particular, people want to know, like, how do you find it, and how do you know if you're on it, and what should it feel like? And so we're gonna go over that right now. I'm Dr. Dan Rukeyser. Today we're going to cover some common problem areas on thrivalmusclerecovery.com. The psoas muscle basically goes straight down from the spine down into the inner hip. And so it acts kind of like a triangle from the spine down to the inside of the hip through here and then through here, right on both sides. You can find it by looking from the hip up towards the belly button, and it'll be a great guide for you straight up through here. So now we know the general area of how to find the psoas muscle. Let's talk a little bit about what the psoas muscle does. Basically, the psoas muscle is a hip flexor. So when the spine is stable, like when you're laying down, the psoas muscle attaches to the lesser trochanter on the inside of the femur. And so when it contracts, it's going to flex the hip and externally rotate the hip in through here. So the motion is just like that. Now that's when the spine is stable. If the hip is stable, then the psoas muscle is going to force the spine into flexion. Now, because the psoas is going to attach in the middle of the lumbar spine, we're going to get mostly flexion of the lower lumbar spine. So if we look at it from the side, go ahead and turn face that way, we can see the angle of the psoas is going to be from the inside of the hip straight across into where the belly button is, right in through here. And again, motion of the psoas is going to flex the hip and externally rotate right in through there like that. The opposite of that, of course, is hip extension. And so we're going to see with good glute activation, hamstring activation, we're going to see the psoas lengthen as the hip goes into extension. One of the problems that we see with the psoas muscle is that if it's fibrotic, if there's adhesion, if it's too tight, we're going to see a forced flexion at the lower lumbar spine. That's going to rock the pelvis anteriorly or forward, and it's going to force the spine into flexion towards the bottom, and then in order to make up for that, the body is going to go into extension, or what we call a hyperlordotic curve. And that's when the spine curves too much. That's the normal curve of the spine, but a tight psoas is going to make that way too much and can lead to injury of the low back. And so what we're going to do in order to find the psoas is we're going to go right from the hip straight up through to the belly button. And remember, this is a very, very deep muscle. It's all the way back against the spine and towards the back. It rests up on the QL on the back side. So there's a lot of tissue to get through before we can even get to the psoas. In a side-lying position, it's really easy to feel where you want to be. And when you're doing this on yourself, you can feel it very easily by lying on your side. What you want to do is allow the abdominal muscles to relax. That helps them fall down to the floor or towards the table. And it also will allow the mesentery, the intestines, to drop down towards the table. That leaves us a lot of space in here to feel into the psoas. Usually, I think people expect the psoas to be way more lateral or towards the outside than it really is. And they also expect that they're going to have to go way deeper to feel it. If you feel for the psoas when you're laying on your side like this, though, it's relatively easy to find. If we start at the pelvic bone here and then just drop in towards this space right here, we're going to feel it almost immediately as long as we're deep enough. And so when we get to it, if you want to feel it on yourself, you can put your hand here and you will feel a band of muscle running in that angle, just like that. And there's no mistaking when you get to it. You're not going to be worried in a side-lying position of pushing on the intestines or pushing on the large intestine, because all of that is falling down towards the table. As long as you come in towards the psoas from the side like this, it's very safe. We've got major arteries on the inside or in the inside of the psoas towards the spine. There's nerves here, but as long as you come in towards the side, from the side like this, you're not going to have any problem. So as soon as we get in deep enough right here, we ought to be able to start to feel the psoas. As you can see, we don't have to really go too deep in order to find the psoas, especially if I'm down this far towards the hip. You should really start to feel it almost immediately as you come in towards the back from the front. So keep in mind that when therapists treat the psoas, generally what we're going to do is we're going to come in from the side and we're going to have our hands curved like this, and we're just going to basically come in and push the more external tissues out of the way until we find where we want to work. Most of the time, what we're going to do is begin to work that muscle into extension like this as we work the psoas. When you do it on your own, most of the time you're going to want to be laying down on top of something, and that's going to be the easiest way to get extension. When we use Thrival, we always lay facing down and use the hip to bring the leg into extension. Side lying is a great way to get a stretch on the muscle, but it's almost impossible to treat it yourself if you're doing self-myofascial release on a side lying position. So keep in mind that down here at the bottom, or the most inferior portion of the psoas, we're going to have that area where the psoas and the iliacus, they meet. And that is going to be all on the inside of the pelvis right in through here. So keep in mind that when you want to treat the most inferior portion of the psoas where it meets the iliacus, you're going to be right inside of the pelvic brim right here. And that's a great spot to work, especially if you're working with hip extension. Iliacus is going to be solely responsible for hip flexion, and so we like to work it in the opposite. We like to work it in hip extension. When we're working the psoas, we might want to work into lumbar extension, and that would be in a side-lying position, just pushing the whole body backwards, lifting up from the shoulder and going into extension that way. Keep in mind that just rotating backwards like this is not going to do a whole lot for extending or lengthening the psoas muscle. A great way to find and treat that area of the psoas and iliacus where it comes together is to work on both hip extension and then lumbar extension at the same time. That way you've got the iliacus sliding this way and the psoas sliding this way, and we're going to be able to get really in between those two muscles right where they merge right in through here. So as we run superiorly from the iliacus up along the psoas muscle, we're going to feel that that muscle dives a little bit deeper and goes more medial, which means more towards the spine. And basically what we're going to feel is a firm rope-like muscle that runs all the way along through this area. And as long as we keep pressure on the psoas and don't pinch any muscle or any other tissue in between, we should be fine, and we can follow this all the way up to where it attaches to the spine, and we can even get to where the psoas and diaphragm start to come together. That's a really great place for a therapist to treat It's a little bit difficult for self-myofascial release, but as a therapist, we like to get all the way up into this area. So as we get in towards the spine, we're going to keep in mind that the psoas attaches at the second, third, and fourth lumbar, and then it makes its way out towards the hip. So we can literally go all the way to the spine with our treatment and with our palpation. For most people, we're going to treat the psoas laying face down. We want to try to feel it, though, laying face up as well. So let's work on that a little bit. So now we're going to feel the psoas and identify the psoas in a supine position. For most people, it's going to be a little bit easier to feel their own psoas muscle in this position. A great way to find it is just to lift the leg up off the table, and you can feel it contract right under your fingers, right in through here. Keep in mind, again, we're going from around the belly button area in a straight line down to the inside of the hip. Very, very easy to feel with a little bit of activation right through here with the leg coming up. Now we're going to talk about treating the psoas using the meat grinders and the Thrival Muscle Recovery Release Board. Now, remember that the psoas muscle runs between the spine and the pelvis, or the hip. So remember, you're going to find the psoas muscle in between the hip point right here and essentially the belly button. It runs between the hip and the spine. A great way to find it is just find that hip point and drop right into the inside. Place the point of the meat grinder just inside of that, and you'll be right on target. Next, we're going to want to measure our distance. For Cam, he uses a 3 and a 3 setting, but it's very easy to test what you need. Just take the board, place the meat grinder in the board. In this case, we'll use 3 and 3, and then just place it where the meat grinder is on the inside of those hip points, and you can just measure it out for yourself exactly where you need it. Let's show what it looks like when Cam treats his own psoas using the meat grinders. He already knows where he's going to put it, and he just will lay right down onto it, right in the perfect spot. He's going to take some breaths. He's going to just let the meat grinder do its job, breathing into it. As soon as he's ready, he can push up a little bit onto his hands and just get some extension, lengthening out the psoas by using the spine, going into extension. He can also, one leg at a time, just lift up the knee, and that brings the hip up into extension, and that gives us a little bit more lengthening of the psoas. If he wants to, he can push up, and he can do both of those two things at the same time, really one leg at a time, focusing on one side at a time. And that's how you treat the psoas using the meat grinder and the Thrival Muscle Recovery Release Board. All right, I hope that gives you a little bit more information on how to find the psoas, what it feels like, how to identify it, and then how to treat it. If you're interested in more videos like this, check out thrivalmusclerecovery.com. We've got videos on self-assessment. We've got videos on how to treat. Check it out.